to their futures. Soldiers speak out. Soldiers speak out. Soldiers speak out. Soldiers speak out. Soldiers speak out.
Welcome to the Veterans Hour, a monthly program of Veterans for Peace, Chapter 109, the Rachel Corrie chapter in Olympia, Washington. Our program this month is on complex trauma, and we'll get into that in just a little bit. We want to welcome two of our guests, Dr. Van Eenwyck and Dr. Langer, who are part of the International Trauma Treatment Program. And we'll get started now because there are some fascinating terms that our viewing audience may not be familiar with. I'm going to turn it open to the topic, since I read this on your website, complex trauma. And most of our viewers are familiar with the term post-traumatic stress disorder, but let's go through the term complex trauma. What are we looking at?
Complex trauma is a term that really derived from working with torture survivors. And what we discovered with regard to torture survivors was that the level of trauma, or the depth of trauma, or the intensity of trauma was much more than what we were familiar with here in the United States. So in the United States, traumas here tend to be automobile accidents, severe illnesses, destroyed relationships, sometimes divorce with children, and sometimes even a terrorist event. But they're singular, they occur once, and then you are in the post-trauma stage. But in torture, people were being traumatized on a daily basis over and over for a number of years, so that the trauma had a different character to it. And we originally just called it the outcome of torture, but then we decided to call it complex trauma because it involved different kinds of torture experiences. There's the one that we're all familiar with, the kind of the Wizard of Id type stuff where somebody is strung up against a wall and beaten or harmed physically. But what we were discovering in Latin America particularly was that the United States was developing some really interesting training methods to help people develop more sophisticated forms of trauma. For example, kidnapping people from a village, mutilating them, and bringing them back into the village. So people who had not actually experienced the torture were seeing and living with the result of the torture, knowing full well this could happen to them next. So the situation became more complex. So for that kind of a situation, we called it complex trauma.
And your work at ITTP deals more with the nature of complex trauma, does it not? Because of the type of practitioners that you work with who are in the various countries that experience that type of trauma?
Yeah, it's pretty much exclusively complex trauma because we're working with people who come from countries where wars have been going on for a long period of time, where natural disasters have compounded the effect of wars. So yes, absolutely.
Well, let me throw out some terms, and Steve will let you take this too. We hear complex trauma, but we also hear regular trauma, of whatever is regular about trauma, but then we are most familiar with the terms PTSD because we see a lot of that related to our soldiers that are coming back from two different wars. And then we have some of the other things that are in the DSM manual, like anxiety disorders and sleeping disorders and some of the things. What's regular trauma?
Well, I think it's important to make a clear distinction here in that the difference between experiencing bad things and being traumatized. And the difference is that when you're traumatized, something happens that violates your sense of how the world works, and that's what makes it traumatic. So bad things happen all the time. I mean, that's life. But to become traumatized requires that somehow it's personal, and that it violates your sense of how things work. So for example, to use the car accident example that John was talking about a minute ago, here in the U.S., lots of people get into car accidents, but they don't necessarily get traumatized by it. However, when, for example, somebody is driving down the road, stops at a stoplight, and somebody behind them plows into them, even though they were doing everything right, and there was nothing that they were doing to cause themselves any danger, and yet they were badly injured and their car was totaled. And they had a sense that as long as I do everything right, I'm not going to get hurt, which is called the just world hypothesis. Then people end up going, oh my goodness. They start questioning their whole sense of how the world works. And that's how people get traumatized. Now, with complex trauma, to kind of get back to the point that John was making, when complex trauma occurs, it's like that violation occurs over and over and over again.
It never ends. It's always with you.
And so it's that questioning how the world works becomes pervasive, and it becomes something that is much more difficult to treat, because it isn't just one event, it isn't just one or two things that happened, it's something that happened over and over again, and oftentimes, like in the case of torture, was done very deliberately to make that happen.
That moves us into what we call a post-traumatic stress disorder, and I don't even like those terms, but
Well, it
we're
makes an
stuck with them.
assumption, doesn't it? It
Yes.
makes the assumption that there's a trauma and then it's over. And when you're dealing with war-torn countries, or you're dealing with sort of natural disasters that happen one after the other, or a combination of the two, then what's the post? There is not necessarily a post. And in fact, I mean, one of the things that we found with the practitioners that have come here, because they realize that here it's pretty safe, they have this real reaction to all of a sudden the world being ordered and predictable in a way that it isn't in their home country. And so they're kind of getting into the, at least a moment of post until they go back to their countries. So I was wondering if maybe you could talk about that a little bit, about what happens with our practitioners and how they react to being here versus being in their own countries.
Yes, that was a fascinating thing for us to discover early on in the program, because we would bring people over here and they would be tremendously grateful for what we were doing for them. And they loved being in the United States, and they could relax, they could take it easy. And after about a month, the tide would turn, and they would become very angry with every little thing that didn't go according to plan.
Here in the United States?
Yes, yes. In fact, one person we brought over once screamed at me that at least in his home country he knew who his enemy was. But coming here, he didn't realize that we were the enemy also. And what we realized was here was a man who had been tortured in prison for a number of years, was living under a highly repressive regime, and had never had the opportunity to really lash back at the people who were doing it to him. And he could lash back at us. And we suddenly realized, oh, this is actually quite positive. This is good. This is the first time he's had a chance to say, I don't like what's happening here. And so we've experienced that with a number of people we brought over here. Not everybody. Some people are in different circumstances. But yes, Steve is absolutely right. And one of the points he was making about the post-traumatic stress is absolutely fascinating. Because as he was saying, we can have a traumatic episode that doesn't traumatize us. But those that do attach themselves to any episode in the future that in any way resembles the original traumatic episode. So in effect, the person is being re-traumatized by reminders of the original trauma situation, even though it's not the whole trauma situation.
Now, you both have said complex trauma is an ongoing thing. There's no end to it. But some of our soldiers are there for a full tour, and some go
Right.
back multiple tours.
Right.
And so it's not just this happened one day.
Right.
They're living in this continual fear and things
Right.
going on, the improvised explosive devices, their buddies are being killed. So this is not just a one-time thing. This is ongoing. Would that be more of a complex type of a trauma they are experiencing at the time?
Yes, and this is something that Steve works with very well in his solution-focused therapy, because what happens in the complex trauma situation is the person adapts to the traumatic situation. In other words, they incorporate it into the way they see the world, the way they behave, the way they perceive. As Steve was saying, their whole philosophy of life, their basic values have now changed. And so when they're out of the trauma situation, they don't know what the world is. They don't know where they are.
They've adjusted to the world that they were experiencing at the time.
Yep.
People do what they do for good reason. You know, I think it's important to keep in mind that we human beings are incredibly adaptive beings, and that in fact that kind of adaptation can, is very useful in a war situation. For example, when you're continually having to worry about your village being attacked by one side or the other. Oftentimes you don't quite know which one, if they're your friends or not, because in theory, maybe the government is your friend, but they might rape and pillage and plunder just as much as the other side does. So the fact is that these folks adapt to that situation, and they do the best they can with that situation, but then when it stops, they're really sort of in between, and they don't quite know what to do anymore. And I suppose we'll talk about treatment and about how communities and people overcome this, but I think that's then the really important piece is, what do you do with these folks? You know, as we were talking earlier before the show about in Israel and Palestine, the Palestinians and Israelis, you're dealing with a whole bunch of really traumatized folks on both sides.
Yes.
And so they're continually reacting in this traumatized sort of way to each other,
Well,
which
I know
really
both
keeps
John and
that
I
going.
have been both in both countries, and I was slightly traumatized because their fear of what was going on got transferred to me, to where until I left the country, I wonder if this is going to be my end as well.
The first time I visited Israel, I had no idea of the whole Israeli-Palestinian thing. I'd read my weekly reader when I was a little boy, and I knew that Israel was a land without a people for a people without a land, and that there were, it's just a wonderful place. And I landed in 1983 and went to bed in jet lag and had a dream that I was walking down the street in Jerusalem, where I was staying, and I saw a man covering his face, and I thought he was crying, and he let his hands down, and it was nothing but blood. So already I was picking up, just from the context, that there was severe, severe trauma there. It was an extraordinary experience.
When our soldiers return home, many times they are unaware that they have been traumatized. What are some of the signs that you're seeing in your practices from people that we could say have PTSD, or they've experienced complex trauma during their deployment? And some are going back 2 and 3 or more times deployed.
Yeah.
What are some of the sort of visible signs that you spot and say, okay?
Well, again, getting back to that idea of adaptation, that they continue to react or respond to situations at home as if they were still back in the war, in Afghanistan or in Iraq or wherever that may be. And so that for example, I was working with a fellow who had been arrested and ended up being thrown in jail because he beat up somebody on the street. Well, he told me that he didn't quite know why he did that, but that was kind of what he had to do to deal with people who he felt were going to be attacking him. He had to fight back first.
Yeah.
And this guy happened to be, as far as we know, the other guy was just more or less minding his own business, although we're not sure. He did something triggered it for this fellow. He was active duty, by the way. He wasn't a vet yet. He was still in the military, and he just attacked the guy. And again, out of context, that seems like a really odd and pathological thing to do. But in fact, given after I heard his story and where he was stationed and how he had to deal with people on the street, it really made sense. He was really using the adaptation to the war situation. He hadn't quite switched over back to being in the U.S., where somebody looking at you funny didn't mean that he was thinking about pulling out a gun and shooting you.
Well, and we've seen some road rage issues too, and it's been quite dangerous actually, where if a car cuts in front of you, I had a colleague went into his glove compartment, pulled out his gun, and his partner said, no, you're not in Iraq. But, you know, he was sure that this was a situation that was going to take out both his partner and himself in the car.
Or people get, driving too close to you or coming up on your side. I mean, people who have been dealing with, improvised explosive devices or cars with bombs in them that people are looking for soldiers to blow up, that, again, it makes sense there. It doesn't really make sense here in the same way.
One of the things we look for, Harry Stack Sullivan, who was the father of American psychiatry, once said that mental illness is a matter of degree, not kind. So in other words, mental illness is the same thing we all do carried to an extreme. And I think with trauma, that's really what we see. We see reactions to situations that are way beyond the norm. So for example, some veterans will come home from a war and they will do nothing but sit in front of a television all day and watch combat movies. Well, that's extreme behavior. Now, some of us might do that every now and then, but they do it all the time. So what we look for with regard to something that needs treatment is the extremeness of the behavior as opposed to what the actual behavior is.
What do you see as some of the symptoms of people coming back from combat or areas that induce trauma in them?
Well, the big three in trauma are hypervigilance, hyperarousal, and flashbacks. Those are the ones we really look for. And hyperarousal can either be an agitated state or a numbed out state. Either way, it's an extreme response to ongoing events of the day that don't make sense in the context of what those events are. Hypervigilance is once bitten, twice shy. You have a traumatic event and you're just looking all over your shoulder for the same thing to happen again, and you'll pick up any little indicator, like the example Steve was talking about, that something is going to happen like that, or even a road rage type thing, where, wait a minute, my personal space is being violated in a way that has meant to me in the past that I'm in jeopardy, I need to do something about that. And that is actually a flashback experience, which we all have flashback experiences at a very minor level, and some of them are very pleasurable. Sometimes we'll hear a song that we heard when we were a kid, and we'll remember a high school romance or something. It's a flashback experience, but it's a very positive one. But for a veteran, it's going to be, I'm threatened, I have to take action, and I have to do it now, and I can't think about it, because if I think about it, I'll be dead. So I just have to go with the spontaneous reaction, and boom, and that's what then leads to the difficulties.
And I think it's important to keep in mind that when soldiers are in a war zone, or for that matter, civilians are in a war zone, it's about life and death. So people, their adrenaline is going, they are hyper alert. And so it's that sort of being totally aware of everything, that hypervigilance that John was talking about, that really gets people because it's so easy to misinterpret as something that happens. But like you were saying, you have to react so quickly that you don't get a chance to engage and think, now, what's this about? And let's figure out what this person was trying to do. Or, that you would be dead by then in the war zone. So these folks react very quickly.
Well, a third of the troops that have deployed to Afghanistan and Iraq, according to the RAND Corporation, have mental health issues. And according to RAND, again, 18.5 of them have PTSD and other issues. And that's a lot of people coming back into our civilian society, again, as they are assimilated.
I would venture to guess that's a huge underestimate.
Yeah, I'm beginning to think that too.
Absolutely.
And when I work at Coffee Strong, which is a GI coffee house, exit 122, and we see a lot of soldiers coming in. And a number, I'll say, how many tours have you had? And they'll say 2, 3. And, I try to get at, basically mental health, and a lot of them will say, oh, I don't have any problems. But I notice where they're seated, and any time that the door comes open, it's like, you don't think?
Yeah.
Well, and I think that's really a cultural issue in the military. And the thing is that it's not okay to admit to any kind of weakness. When you're in the military, when you're carrying a gun, when you're supposed to be the powerful one, the one in charge. And of course, the thing about war is that you're ultimately out of control. And you try to exercise the little control that you do have. And so that, again, is an adaptive response. but again, it's like you were saying, it's doing so much of it that it becomes a problem. And by the way, when people talk about mental health issues and PTSD and so on, I always think of it as a response to trauma. And I'm always reluctant to pathologize all of that because I do think it is adaptive. And so what we need to do is we need to get people to adapt to what is now rather than what was then. Again, if we can talk about post, if you will, the way we were talking about post-traumatic stress disorder earlier. So getting people to shift their adaptation back to living, say here, where there are very different considerations and it isn't life or death every moment. That's a difficult task. And I think that's difficult for all of us. So I'm always reluctant to sort of pick out sort of veterans or the military or other folks in the war zone as somehow being pathological. I think it's the situation that's pathological that they've adapted to rather than that they necessarily have a pathology in that sense.
ITTP works with people in a variety of cultures. And we have the culture where we say the military culture of the United States, but you've had an opportunity to be among clinicians, practitioners in a variety of cultures and countries. What have you learned from their traumatic events that they were able to deal with the trauma from their unique position within their culture? And what have you learned from that has changed the practice of psychology, psychiatry, counseling, whatever we want to call this whole area?
Well, one of the really important things we've discovered as a result of both going into the countries where we do our work and bringing people from those countries to the United States is that every culture treats trauma. This is something that seems somehow to be lost on a lot of practitioners and a lot of non-government organizations, the charitable organizations, the white knight syndrome that we know best what people need to know, and we have the most sophisticated methods for dealing with trauma, and all we need to do is go into these countries and teach them 10 steps to trauma renewal and they'll be fine. And that's what we find. That's what Steve and I encounter every time we go overseas, and it's utterly nauseating. And what it boils down to is there's no such thing as a culture that hasn't been deeply traumatized by one thing or another. Wars, natural disasters, you name it, droughts, starvation, disease. So they all have ways of treating it, but they're embedded in the culture. They're not taken out of the culture, as we do in our culture here, and call it trauma treatment. It's not therapy. It's just in the culture itself. So what we found is every culture has that. And when we go into those cultures, we don't necessarily see it. We have seen what's in our culture, but it's hard often to see it in their culture. And the practitioners there are the ones who have to educate us as to how trauma treatment is proceeding in that culture and how we can assist them to develop it to a more effective way of dealing with people.
Well, and I know you call this a collaborative
Totally
response
collaborative.
there.
Yeah.
Yeah. And how has that changed from how you were classically trained to counsel people within the areas of that you would work for people that have been traumatized?
Well, I think it's actually quite consistent. Steve can speak to solution-focused therapy, which really is completely in accord with what we do. And I'm a Jungian, so
Yes.
one of the things that Jungians look at is we love symptoms. We believe that symptoms are the attempt at the cure. So if you want to know what's going on and how it needs to be cured, look at the symptom. Don't get rid of it. The last thing you want to do is get rid of it because then you've destroyed your biggest piece of evidence. But Steve's solution-focused therapy really works with people to find out how they've adapted in the past.
Well, one of the things that we always look for is the resources that people already have, that they're
Yes.
already employing. So that's, I think, really an important place to start when you're working with people is ask, what are you already doing that's working, even a little bit? And when you start asking that question, which is a very different question than most experts coming from Western countries going, say, to Uganda and Africa or Zimbabwe or to working with Tibetans or Palestinians or whatever, we go in and we ask, what are you already doing that's working?
And what have you found as an example that we could share with our viewing audience, some things that worked there that maybe was surprising, that wasn't in the textbooks that you've gone through?
Well, one of the things that I think we both discovered early on when we were all learning about something called critical incident reduction, which was an attempt to get people to talk about the trauma immediately afterwards, so it would help them then to kind of integrate the whole experience. We discovered in a number of cultures the most healing thing is to never mention the trauma again. It's gone. It's over. It's done with. Put it behind you and just get on with life. And so to go into a culture and say, okay, now the first thing people need to do is talk about their trauma completely destroys the method that people have evolved.
Re-traumatize them.
Exactly, exactly.
Well, because remember, just because somebody experienced a really bad event doesn't necessarily mean they're traumatized. But we can create trauma, if you will, in the sense that we've been talking about. Yeah, by labeling it that way and saying, oh, this is a really bad thing. You now need treatment. And then, you know, because one of the things that happens usually after really momentous events is that people are in a sort of a trance, if you will. And so they're very susceptible to how you talk to them and when you say something, they will take it in a very literal way. Let me give you just a U.S. example here that I can think of. I was working with a woman who was in a very bad car accident, and the fellow who was drunk and crossed the line and hit her was killed in the accident. Luckily, she was severely injured, and her passenger was also severely injured. And one of the police officers, I think with no bad intent whatsoever, said, "Oh, you killed that guy." And sort of try to make light of it somehow. Not a good idea. But the fact is that she took that in. And she all of a sudden had this guilt that somehow she'd killed this guy, this drunk driver who had come across the lane to go head on into her car. And so how we talk to people afterwards, after a trauma, is so critical. And I think actually that's one of the things that I really love about what people in other cultures do, is that they have rituals, for example, where they deal with these things and where they have a way of simply dealing with it in a way by dancing or by having a group that gets together and does like a healing with the person, can be so powerful because it sends this message of, we care about you, you'll be all right, we're here for you, rather than you killed somebody or you did something bad or you now have a label.
Yes. You know, we're watching some pretty horrendous things going on right now. We turn our TV, CNN, or wherever we're getting our news feed from. We read one of our news reporters was killed. But the majority of civilians are affected by the type of violence that they're experiencing. In your experiences with International Trauma Treatment Program, are there certain countries, particularly in those areas that are currently undergoing a great deal of strife, that they have different cultural coping mechanisms to deal with what we see as hopeless for them?
Well, a couple of the things that we've experienced all over the world that are kind of similar from culture to culture are really the two biggest forms of trauma treatment in any culture, possibly excluding our own and maybe even Western Europe, are religion and the arts. And as Steve was saying, dancing, singing, that kind of a thing. And one of the things that happens in complex trauma, and sometimes this is done deliberately, is people are alienated from each other, and they're alienated from themselves. Things go on inside them that they can't understand and they can't relate to, or they're alienated from the community because they feel either they're a liability to the community or they have somehow shamed the community, but at any rate they feel alienated. And religion and the arts bring people back together in a group setting where there are rituals that always help people to understand where they're lacking, where they can do better, and that's accepted by all the people. So, for example, when we go to the Middle East, one of the big things we encounter, obviously all the time, is Islam. And Islam is a very communal religion. When we're in Sri Lanka, it's Hinduism, because we work in the Tamil area. If we're working in the Sinhalese area, then it's Buddhism, but it's Theravada Buddhism. It's a whole different type of religion. But all of these religions have become incorporated into the way people see the world. And it's very helpful to then be able to help them to see their traumatic experience, whatever that may be, and you don't even have to mention the traumatic experience. You can do it through whatever's going on in their lives at the moment that can be integrated with their religious and their artistic outlook.
Well, in fact, I guess I wanted to make a point about the indigenous, if you will, trauma treatment that we don't necessarily pay attention to, but ought to. And that is that I'm always amazed at how few people are, in fact, traumatized when you're dealing with these kind of situations. It always strikes me that given what does happen and the really horrible and awful things that people go through, that everybody isn't. Because usually the percentages are, you know, when you're doing studies on PTSD and say natural disasters in the United States, it's anywhere from 5 to 20% approximately. How come the other 80% or 90% aren't traumatized? I'm always puzzled by that.
I'm glad you're puzzled, Steve, because that was something I've always
And I'm grateful for that, mind you,
wondered
because
about. Like, if you've gone through this experience,
yeah.
shouldn't you all be traumatized from this? And
Well,
clearly that doesn't happen.
That's a fascinating issue. And one of the issues about it is that it is not always the traumatized person who manifests the symptoms of the trauma. It could be their family. It could be their spouse. It could be other people in their community. And what I've found in a lot of communities is that there will always be a certain number of designated vulnerable people who are expressing the trauma of the community in their own trauma. And I think that happens here too, especially with veterans. When they come back, they carry the trauma of the culture over the war. I mean, people see these things on television. They hear about children being killed, families being bombed, people being tortured by our government, which is highly distressing to people. And we all kind of stiff upper lip it and kind of get on with things, but there are certain people in our culture, in every one of our communities, that we all kind of see as maybe, they're not quite as well put together as the rest of us, and they're expressing our symptoms while we're suppressing the whole thing. We learned this in psychology a long time ago when people would bring their adolescent in and say, there's something wrong with my kid. And then we'd say, let's see the family. And the family would come in and we'd start talking and maybe the father or mother or one family member would say, this is all crazy, I'm leaving, and get up and leave. And we'd go, there's the problem. So it's a subtle type of thing. But Steve's absolutely right. The symptoms of trauma are not generally shared equally among groups that have been traumatized.
Well, and I think one of the advantages that, for example, African cultures have is that they are so much more communal in nature than ours. We sort of are rugged individualists. We should solve it ourselves. And so our treatments have evolved based on that, okay, it's the individual's problem. Whereas in more communal cultures, it's really the community that takes it on and that helps heal individuals in the community. I mean, just as an example, when I was in Kampala visiting with the organization that I was working with, and I said, I want to go get some gum down the street, and I was just announcing it so they would know where I was, because they sort of worried about me being okay. And so as I was walking to the gate to go outside, there were 7 people lined up, because they assumed that when I said that meant we were all going to go down there for me to buy some gum, because people are always together and they always kind of hang out with each other. And it's a very odd thing to be in your own room by yourself, for example. Unless you're sleeping, you're with other people. You're always hanging out with other people. Yes. You're always being with other people. You're always interacting with other people. I mean, again, as an American, it was wonderful, but after a while, I just kind of had to retreat into my room because I wasn't used to this sort of very communal experience and continuous communal experience. But I think it has such potential for healing, especially for things like trauma, that I think we miss in our culture because we don't have that sense of belonging and togetherness and defining ourselves by our connection with others versus just defining ourselves by ourselves.
Your website mentioned that the practitioners have become innovators and have come up with some unique methods. Tell us about those.
Well, let's see. Probably the one that I'm most familiar with would be Sri Lanka.
Okay.
And Sri Lanka has one of the programs we work there is an art program. And it's art, theater, music, drama, and it's all Tamil art, theater, music, and drama. And what the practitioners there have done is they have given the children, because it's a children's program, free rein to express whatever they want to express through the art. So one of the things we saw after the tsunami was the children got together and spontaneously decided to do a bunch of theater pieces about the tsunami. And the first one was they put the tsunami on trial, and one little girl was the judge, and one guy was the tsunami, and they banished the tsunami to the sea. Another one was two little boys being killed by the tsunami. Another one was children being abused by their uncle who had gotten money from a government organization to take care of the family after their parents had died, and he just took it all and drank. And then the last one was two NGOs, two aid organizations from overseas fighting with each other physically over who would get to give benefits to a family. And the kids were laughing uproariously through the whole thing. So they were, at the same time, reliving the trauma in a context of group humor and laughter and camaraderie. And it was an absolutely brilliant way that none of us would ever have thought of to actually do that kind of thing. Now we have psychodrama in the United States and all of that, but it's always organized by somebody else. It's always kind of imposed on the population. But that's one thing.
Well, let me give you another example in Uganda. There was, when I was at one of the refugee camps, a group of women who were widows had gotten together, and they and their children would get together on a regular basis. And of course, in Uganda, being a widow is a very bad thing, because the woman goes to the husband's family, and especially in the refugee camp situation where people don't have a lot of resources, those widows with their children, they say, well, you aren't part of our family any longer. And so they are kind of on their own. And so they would get together and they would help each other working the land. They would help each other with childcare. They would help each other with all these sorts of things that supported their own people in a way that they just spontaneously had come up with it themselves, and were doing it, and were taking care of each other, especially because men would come and take their stuff. And so one thing that they worked out is that they, instead of owning things themselves, they would have the camp leader be the one that officially owned what they had. And so if there was a problem and one of the men would come and take one of the widows, say, the hoe that she worked the land with, then that man had to answer to the camp leader rather than this woman who had no status or very low status within the community. And so they came up with some really creative ways of dealing with some really difficult situations.
One last one, we had a man from Tibet who came here, Tibetan settlements in India, and went back and realized that he could make a parallel between Tibetan Buddhism and the cleansing of karma and torture. And so he began to teach some of the torture survivors that their karma had been cleansed by the torture and they could celebrate that. And that was a very innovative way of...
That's not in any textbook you would have come across.
We haven't really learned that one in school.
No.
Right.
No. Your website did mention, John, that complex trauma has become more sophisticated. What did you mean by that statement?
That's a tough nut. That really is a response to the United States being able to assist torturers in other countries to torture people without leaving evidence of the torture. One of the biggest problems with torture, especially physical torture, is that it leaves marks. And those marks can then be used to prosecute the torturer as evidence that the person was tortured. And what's happened over the years is, as a result of some of our colleagues who have gone into government service, they have developed highly sophisticated psychological techniques of traumatizing people and torturing them, so that the complex trauma basically doesn't really have a direct cause, but a kind of peripheral cause. And that's the case I mentioned in Latin America, where you take somebody, you pull them out of the village, you torture them, you put their eyes out, you then put them back into the village as an example of what will happen to you if you in any way step out of line. Very sophisticated way of traumatizing an entire community. So the treatment methods, not the treatment methods, the torture methods have gotten more sophisticated over the years in the pursuit of impunity. In other words, not being able to be punished. So that's what we're seeing.
I know that there's an international torture day
Yes.
that calls attention, and I remember being in Vukovar, Croatia, where you've been too.
Yes.
And I had a booth, and we were passing out information about the International Torture Day. And my daughter was taking pictures, but she was standing across the street taking pictures. And later on, she says, "Dad, did you notice what was happening when you were passing things out?" I said, "What do you mean, Bonnie?" She says, "All the adults saw the word torture, and they went out of their way to bypass where you were."
Yeah.
The kids would come up to the booth to see the torture victims' pictures or information. They'd pick it up, but all the adults avoided you. And so I asked my colleague there, "What does this tell you?" And it says that they were either those who were tortured or they did the torture. And so the
Exactly.
whole community was affected by that.
Right. Yeah, that's something else we've discovered, is that a lot of the people who are torturers were themselves tortured. And torture then became a way of preventing themselves from being further tortured. And that's a horribly debilitating experience for people. That is a tough, tough trauma to heal.
Now, Steve and John, both of you have been in other countries. How did you identify potential people to come here to Olympia to be part of this international trauma treatment program?
Originally, we were part of a group, and still are, called the International Society for Health and Human Rights.
Okay.
We would go to their conferences, which are once every 3 years, and people would hear about us and say, "We need you to come. We need you to come to our country." And they would invite us to come. Then when we would go into the countries, we would be very impressed with some of the very local practitioners who were not trained in the universities. They had no government support, and they had no financial support from the big aid organizations. They were simply good-hearted, brilliant people trying to work on trauma in their communities on their own. And then we would identify them, as Steve did in Uganda the first time he went there.
Yeah, there are just some natural healers where you can tell that they're no nonsense, but they really get it about working with people. And when you see somebody like that, that's the kind of person that you want to tap and get to come here to Olympia so that we can work with them more intensively and then be able to send them back to do good works there. One of the things I think that we also just need to mention briefly is that we don't actually work directly with the victims other than in a teaching capacity so that other practitioners learn what to do. Because we aren't going to be there. We aren't going to be able to take care of them on an ongoing basis. We need to work with the practitioners who are actually going to be doing it. And I know that John is, and I am too, in contact by email with some of those folks, and then help work with them if they have questions or if there's something that it makes sense for us to talk about, then I'll get an email from someone and we'll talk about what happens. And I think and with the internet, and because even in a lot of those countries there are internet cafes and so on, we can communicate with each other. It's really a great way to sort of internationalize the help for people who've been traumatized, just like the torturing and the sort of creating victims has been internationalized by governments.
I guess here is a good segue into the get out your checkbooks, friends. Here's how you can make it possible for practitioners to come and benefit from the teachings that Steve and John have. So here's an unashamed advertisement. How would they make it possible for these people that you would like to see receive this training?
Well, the main thing is we don't take any money from the government, and we have no foundation support. All of our funding comes from private individuals in Olympia. And we do that for a number of reasons. First of all, when we go on the ground in another country, if we are in any way funded or representing our government, we're out of the picture. People are not going to engage us at all. When we go in, they have to fund us. They have to give us room, board, take care of us while we're there, transportation. So they know we are as vulnerable as they are in the situation. So what people need to do is simply get their checkbooks out and send us money, because our budget is very, very small. I think our budget is somewhere around $32,000 a year. We have one half-time employee, and the rest of us are all volunteer. All of the clinical faculty are volunteer. Our clinical director is a volunteer. Our accountant is a volunteer. Our board is volunteer. So it's a lot of bang for the buck. In terms of donated services, we get donated about $90,000 a year in donated services. So people get a big bang for the buck out of their checks. And please, if you can support us, if you can send us a check, the information on how to do that will be at the end of this presentation, and we would really deeply appreciate it, because we're, like all other organizations right now, vulnerable and could use more cash.
And I know you have a website, which is www.ittp.org.
Yes.
And our viewers can watch that, and hopefully from time to time it'll get updated, as most web pages need to be.
They can donate right on the web page. Just go to the web page and you can donate. All tax deductible.
There you go. What does ITTP do that's different from all the other organizations that would seek to make a difference with people who have suffered trauma?
You want to do that one?
Well, I'll start and you can finish up. Probably, I think the thing that we do really well, and I think John has more experience with different working or dealing with different agencies, is that we really work with the resources that are already at hand and build on that, rather than assuming that we are the experts, we're going to come in and we're going to sort of pass out the truth to them and simply tell them what they need to do. So it's a very different approach than most of these programs, where somebody sort of parachutes in, so does a pre and post, research sort of questionnaire, and in the meantime does some kind of treatment that they think ought to work, and then they do it to publish something, and that's their purpose, rather than necessarily to just be there for the people and helping them to build their capacity. Because that's really what we're about. We want them to be able to do what we do. And we want them to, and in fact, they become, when they complete our program, they become practitioners along with us. I mean, we're all on the same level once they've completed the program.
And how long is this program in Olympia once you get a person coming from overseas?
It's about 3 months. We
About
bring
3
people towards the end of August and keep them until the beginning of December. So it's a 3-month program where we show them what we're doing as a way for them to be able to increasingly identify in their own culture what's being done there that can then be heightened as a particular trauma treatment technique.
You've had trouble with visas for
Yes.
some of the people. How have you overcome this, or is this continuing to be a problem?
Depends on the country. Getting people out of Gaza is impossible. Israel will not allow them out. So we can't bring people from Gaza, and there's no way we can deal with that at all. Our government is absolutely ineffectual to do anything. One of the things we have done is we have gone to the embassies when we're in the country and explained the program to the consular officials. And when they hear what we're doing, they're usually very favorable towards what we do. And finally, having been in business now for about 15 years, everyone we've brought here has gone back. And that's a track record that then
Well, and that's one of the issues on giving a visa. Like if
Exactly.
you come here, you give them the treatment program,
They're going to stay.
They'll stay
They'll
here.
jump the visa, and right. And so we've shown that no, the people that we bring over here are desperate to get back to their countries because they don't want to be away from the need that they can address.
I mean, these are incredibly committed people. They really want to take what they've learned and take it home and use it. I mean, they are really chomping at the bit when they're ready to go home. So we have an excellent track record, and for good reason. And I think, again, once we explain it, people have a better sense of that.
I know our time is getting close to the end, but I am concerned that our viewing audience will hear the term complex trauma and PTSD, but you also deal with people that there is no post, it's just always ongoing. What do you do differently for that type of a person versus one who clearly has been identified, at least in the DSM-4 manual, that it's post-traumatic?
Yeah, well, that's an excellent example of going into a culture and seeing what they're doing. So when we go into Sri Lanka or we go into Gaza, and even when we went into Uganda, which was just at the end of the Lord's Resistance Army doing their job there, and of course that gets brought back up every now and then. One of the things we look at is what is the culture already doing? And two of the things that we've found in a number of different cultures is resistance. In other words, people who are ongoing trauma to begin to understand that what's happening to them is wrong. It's wrong, it's unjust, it's illegal, it's recognized by the international community as unacceptable, and they are on the side of right, and they can resist it. And then that brings the second thing, primarily by uniting with each other in a kind of group resistance to what's going on. So for example, in Gaza right now, I was in there in January, everyone has, as we would say in the Northwest, hunkered down. They're just hunkering down. They're just all absolutely consolidated on the fact that they're not leaving. They don't care what gets thrown at them. They're going to stay. Well, that breeds an enormous amount of strength, resilience, and community interaction, which is really helpful to the culture. So to the ongoing end of the trauma, there are really two things that we do. One, we go in and we help people to identify what's already being done. And then from here in the United States, we scream bloody murder about this stuff. We scream to our elected representatives. We scream to the representatives of other countries. We go into the paper. We do this here. We let people know this is wrong. We are citizens of the world, and we don't have to put up with it. We don't have to just sit idly by and watch it happen. So those are the two things that we try to do.
A person who is going through their college program may be watching this program and suddenly say, I'd like to get into something like this for a career. And I know you come from two different schools for working with people that have mental problems. What would you suggest for our young people who are looking at, hey, I could see myself doing this type of a career move?
I think that's a good question for the city council member to answer, because he's much more institutionally oriented.
Well, you know, it's clear that what people need is a good foundation of sort of understanding human nature and what it's about. And you know, whatever sort of training you originally come from isn't as important as being able to really get a sense of how people work and what are universal sort of human characteristics. And so there are a number of different programs. They unfortunately are all pretty pathology oriented. So you know, social work, psychology, psychiatry, you know, those are all programs where you have to kind of find places where they teach some of these things, because you actually have to look for them. But they're in each of the mental health professions have little corners where this kind of stuff is being taught. And so they would have to not only identify a profession, but then find a place where they can learn these sorts of things.
I jokingly say that, and all of us have PhDs here, which, you know, I jokingly say it's piled high and deep. But you don't have to have a PhD to get into this field initially. What options do you have?
You don't have to have a PhD to get into the field, but you have to have a PhD mentality. In our culture, a bachelor's degree is where you learn about all the various things you can study. Master's degree, you learn how to use the tools in one of those fields. PhD, you learn how to create the tools. And one of the things that ITTP does more than anything else is we create the tools. And when people come here, that's what we're teaching them to do, create the tools. We don't care if they know methods. We don't care if they know procedures and theories and that sort of thing. And we have more than just psychologists on our faculty. We have body people. We have emergency room physicians. We have, what else do we have? We have
Artists.
dispute resolution.
Yeah.
And what?
Artists.
Art, a lot of art
Yeah,
therapy
yeah.
type stuff. And all of our practitioners, all of the ones who are on our faculty, are PhD oriented. They may not have their PhDs, but they're constantly creating new ways of doing things. So what I would say to people who want to get into this field is learn how to create the tools that will be needed for the work you're going to do. So get into the work, start doing it, and learn from everybody else who's doing it already. What we have learned, we've learned from the people in the countries that we attend, that we go to. They've taught us. That's why we go. And then we learn a lot more about what we can do here. So those would be the two things.
We have room for a minute from each of you to have a concluding thought that you can share with our audience. And this would be your opportunity to give the one parting shot for them to remember. I'll start with you, Steve.
Yeah, I think that doing this kind of work is I mean, I feel privileged because it's a great gift to me. I've learned at least as much as the people that I've taught what they've learned. And I just so much appreciate that, and it really has enriched me working with these people. And so I feel like it's a privilege, and I'm sort of cheating in a way because I'm getting more out of it than they do.
Thank you, Steve. John?
I would just like to say that Olympia is the perfect community in which to have a program like this. We have had enormous support from the citizens of Olympia who are intelligent, well-motivated, active people who care about what's going on in the world and who embrace the people we bring here as if they were their own family. So we have people who are host families who donate their residences for free to people. We have people who help us with the logistical support, transportation, that sort of thing. We have a faculty that's all volunteer. I would like to thank the citizens of Olympia for supporting this program and for finding it to be congruent with the very principles on which this whole community operates. So thank you very much, and get out those checkbooks.
Amen.
Well, I want to thank you on behalf of Veterans for Peace, Chapter 109, the Rachel Corey chapter, on sharing with us not only complex trauma, but a variety of traumas and the work that you do. And we're glad that you're in our community. Thank you.
You're very welcome, and thank you for
Yes.
being in the community and for doing the work that you do, which is absolutely superb.
Yeah, thank you very much.
Soldiers speak out. We can tell the truth of what we've seen. We are not liars. Soldiers speak out. We have a duty to all children and to their future.